Hi, Dr. Bergoli.
Hello, I thought it was me.
No,
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 well, Mary Beth's late tonight.
no. So the mayor, so Stephen with the mayor's office is kind enough to host this and set it all up for us. So he opens it up to let us in.
Okay,
Beautiful.
that was very kind of him. How are you, Arthur?
I'm doing fine. I miss you guys.
Tell him you got your second shot.
Yeah, I got my second shot, thanks to Mary Beth.
You'll be at Bertucci's at no time.
Yeah, you never know. Okay,
Are we ready?
I'm ready.
Right. What's going on? What are they-
Okay. Call to order. The Braintree Board of Health meeting will now come to order via a Zoom meeting. This is March 11th, 2021 at 7 p.m. Present, Mary Beth McGrath, Director of the Department of Municipal Licenses and Inspection, Dr. Philip Nettleman, Vice Chairman, Dr. Arthur Bergoli, Chairman. Board of Health meeting agenda, March 11, 2021, 2 pages. Approval of the meeting minutes, January 14th, 2021, 3 pages.
I move they be approved as read.
I'll second that motion. All in favor? Aye.
Mary Beth, you want to
Mary
do
Beth?
something?
Sure. The list of complaints.
No, don't we have to agree? Don't you have to say yes and yes?
Oh, okay, sorry. So it's a roll call.
Thank you.
Yes.
Dr. Nettleman, yes, and Dr.
Yes,
Bergoli?
yes,
Yes.
yes.
Okay. List of
Okay.
complaints received from January 11th, 2021 through March 5th, 2021. Mary Beth will discuss. Mary
Yeah.
Beth.
So as has been the case for the last good number of months, the 99.9% of our complaints are COVID related. So instead of me continuing to bring all of them back into you individually, I wanted to let you know what sorts of things they are. The majority of them, of course, are masks, also social distancing requirements in restaurants, making sure tables are 6 feet apart. Debit card readers are another, that they're not being cleaned routinely. For example, in grocery stores, people that use the debit card readers, they have to punch their number into the pad, so that having to be routinely cleaned. Restaurant capacity for number of patrons, and then also gym classes, fitness like health center gym classes, and persons making sure that the classes are not over capacity and able to maintain the 6-foot distance and mask wearing. So those are the majority of the complaints. The others are just general trash complaints. As the weather gets nicer, obviously the snow is uncovering things that have maybe blown around during the winter, and we're getting those sorts of complaints. But the majority are masks. Now, effective on March 1st, the governor's order changed to where we went back from phase 3, step 1 to phase 3, step 2, which provided for more capacity in such places as restaurants, fitness clubs, personal care services. So allowed for 50% occupancy up from 40% occupancy. It allowed for more opportunity in restaurants that now they just need to maintain the 6-foot table separation, and also continue doing the no more than 90 minutes for a reservation. So things like that. The effective March 22nd, if the COVID statistical data, health data continues to go in a downward trend, the governor would be considering moving things on March 22nd to phase 4, but that's pending and subject to what the data is at that time. So
Thank
that
you.
will open things up even more.
Thank you.
Thank you. New business. 1, request for keeping of animals permit. A, Ting Ting Zoo, 98 Prospect Street North, 2 chickens. Application and supporting documentation and regulations, 12 pages. Mary Beth.
Yes. So Mr. Ting Ting is on the line. If they can unmute themselves, if you'd like to speak to the board.
Oh, hello.
Hi.
Hello.
Oh, hi.
So, Ting Ting has submitted an application to the health department requesting for the keeping of 2 chickens on her property at 98 Prospect Street North. And if you look in your packets, I have provided all the information that she had submitted with her application. In addition to that, just a general site plan of the area in which she lives on Prospect Street, which is, it abuts off of Abbott Street, as well as Stores Ave is in that area as well, just to give you a general idea of where it is, the specific street location. The proposed coop is it behind the dwelling and adjacent to the garage, and it would be 10 foot off of the rear property line and 10 foot off of the side property line, which is what the board has requested applicants maintain. The applicant has submitted all the required documentation such as proof of ownership and as well as notification letters that were sent to the direct abutters. We have not received any communication back, whether it be writing, email, or telephone from any of the direct abutters with either an objection or support in favor of it. I've not heard from anybody, but she did make notification to all of the direct abutters.
Yes.
Is there some kind of, the last page, I guess this is a mail receipt?
Yes.
I mean, these were hand delivered
Yeah.
on March 4th.
Yes, so in speaking with our town solicitor and the way that the regulations read as well as the state regs, there's no requirements that, so when the applicant is indicating that they are either hand delivering it or sending it by US mail, then we have to presume that that was fulfilled based on what their option was as a method of delivery. Unless for some reason we were to find out otherwise. And in this case, she's indicated that she has submitted or sent the hand delivered the letters to the neighbors. And so based on that information, it's our assumption that the letters were received by the neighbors and we have not received any notification back from them, so.
Okay, isn't that a little unusual?
Well, based upon a previous applicant that had come before the board, and there's some confusion about the method of delivery, because we always wanted proof of notification, but the town solicitor reviewed the regulations and said they're not very specific and clear that states that you have to do that. So, and based on legal service, if one sends the letter by mail, then unless we have any proof that it wasn't delivered by the U.S. Postal Service, then, if they show that it was, if it was sent, then we're to assume it was delivered. The same in this case where it was hand carried. The applicant is certifying that that's what they did on this application. So that's what we need to move forward with.
Okay, but in other cases, you have never checked with neighbors that were supposedly contacted, but that we didn't hear from. I mean, we've certainly heard from neighbors who object.
Right. But in this case, she's indicated that she has hand carried it to each of the abutters. And I always like to tell you whether or not I've heard from them. In this case, I have not heard from any of the neighbors.
All right, so, okay. Could you please tell me the distance between the coop and the house, lot 98, number 98, on her drawing?
That I'm not certain about, but she can certainly speak to that. Ting Ting, are you able to advise the board how close the distance between the chicken coop is, or the proposed chicken coop is, and where the house is?
I think it's about 20 feet. And the one on Stores Ave is really far from my yard. It's basically behind my yard. That's another empty lot, and it's 90, what's the number? 97, 87 Stores Ave. That property is next to the empty lot behind me. And the 96 is close to me, but the coop will be against my garage. So from where the coop is will be, I don't know exact how far it is, but I guess it's 20 feet because it's like 2 garage wide. And from the coop to 106 Prospect is about 2 garage door wide as well. So that's about 20 feet.
Mary Beth, this is for 2 chickens. What if she wanted to go to 4 or 6?
That's not an objection. She just needs to notify the department.
Okay.
I mean, the regulations do allow for more than 2, so, but at this point, she's requesting 2.
And are you as a department happy with the care, cleanliness?
Yes, so she'll be composting. The proposal is to compost the manure, and she does understand the responsibility of composting. Ting Ting, what the Board of Health normally requests, and they wanted information. The coop obviously will be fenced in around the actual structure. And so to prevent wildlife from going into the coop area, when you put the fencing up around the coop, the building, the structure, that the fencing should be buried into the ground so that wildlife such as coyotes, foxes, etc., can't get into the coop.
I see.
I have no other questions, Arthur. or
No,
Jeff.
I have no objections. So would you like to put forth a motion, Dr. Nettleman?
I make a motion that it be accepted.
So we'll approve for 2 chickens to Ting Ting Zoo at 98 Prospect Street North. I second that motion. All in favor? Aye.
Aye.
And roll call vote, Dr. Nettleman,
Yes,
Dr. Bergoli.
Yes.
Okay, so Ting Ting
luck.
will be issuing the permit tomorrow, and Amy will be in touch with you.
Okay, thank you so much.
Thank you.
Thank you. B, Ryan O'Rourke, 14 Tingley Road, 12 chickens, application and supporting documentation plus regulation, 11 pages.
Yes, so,
Mary Beth.
yeah, Mr. O'Rourke is on the call this evening. And Mr. O'Rourke, if you can unmute yourself, then you would have the opportunity to speak to the board. Mr. O'Rourke is requesting for a permit for the keeping of up to 12 chickens at 14 Tingley Road here in Braintree. You have in your, and some of the things he's proposing, the coop itself would be 3 by 3 by 3 with a 5 by 10 run, fenced run. His plan is to compost the manure on the property from the chickens. You do have in your packet the area map of where Tingley Road is in location to other streets in Braintree. And then you also have just a drawn plot plan based on Amy's inspection, what the distance would be between the coop and the property line. So this is in the rear of the property of 14 Tingley Road. It would be adjacent to a shed. It would be at minimum 10 foot from the side property line, beyond the shed, on the other side of the shed, and then 10 foot from the rear property line. So he has met what the board's objective is of at least 10 feet. And he has made notification to the direct abutters as well, hand carrying, actually these were mailed to the property owners that are abutters to him. And there's also the proof of ownership in the packet. The only thing that I would, and Amy's been on site, done a site inspection and has recommended approval. I have questioned the need for 12 chickens. That's a little bit excessive on properties, especially, residential properties that aren't that large. So I probably would recommend that it's not that many chickens, but maybe Mr. O'Rourke can offer something a little bit more limiting as to the number as opposed to 12. And I
Yeah.
realize the regulations allow for 12, but again, the property is not that large.
No, it's not that large. Less is definitely something that we would be comfortable with. Maybe something around 6. I was actually under the impression that Massachusetts only allowed 6, but because I saw 12 there, maybe I got a little trigger happy, but 6 would be something that we're much more comfortable with. Or you
6
guys?
is fine.
Yeah.
I'm all for 6.
6 is perfectly fine.
Right.
Appreciate it.
And Mr. O'Rourke, can you explain the makeup of the coop with regard to the fencing and trying to make sure that it's secure from wildlife entering it?
Sure. There's actually 2 forms of protection there. The run itself, which is just the cage area which the chickens are allowed to move. That's a connection to the coop. And then the yard is fenced as well. And there's actually plans to put in a gate. So there's actual, locked fencing in the yard, and the chickens will be inside of the run.
Fine with me. I make a motion to be approved for 6.
I'll second the motion for 6. All in favor? Aye.
Great.
Aye.
Roll call vote, Dr. Nettleman,
Yes, aye.
Dr. Bergoli.
Aye, yes.
Okay, so Ryan, Amy will be in touch with you tomorrow regarding the permit issuance.
Many thanks.
Okay, thank you.
Have
Good
a good
luck.
evening.
Mary Beth,
Yes.
I'm just concerned that a week or 2 from now, you may get a call from a neighbor saying they never received the letter.
Well, those letters were mailed, US mailed. So again, in
I
speaking
see
with our
that.
town solicitor, her comments are then we're to presume that the US mail isn't performing their duty, and which I have no proof of that. So I'm to assume that it was mailed.
What about, aren't some of them, what do you
Return
call it?
receipt?
Pardon me?
Return receipt?
Well, we used to have it that we required proof of notification.
Right.
Yes.
And so most recent, you may remember Dominic Candelari's application came before the board, and there was a concern about him being able to make contact with his neighbors who weren't available, and he wasn't able to get that service provided, which kind of was holding up his application. And there was some communication with our town solicitor. When she reviewed the regulation and the state statute, she said that if it's being mailed or hand carried, the applicant is swearing under the pains and penalties of perjury that they've either hand carried it or that they have US mailed it, and that's satisfactory service, considered satisfactory
Okay.
service.
Okay, all right, just trying to protect you.
The only question I have is, in the future, should they tell their neighbors how many chickens they're getting? Obviously, if those neighbors heard 12 chickens, that might have been an issue. 2 chickens, I don't think anyone's going to care.
Right. So in the future, moving forward, we'll ask the applicants to make sure they identify in their notification to the abutters what their intent is and like how many they would intend to keep.
Isn't the
Okay.
maximum 12?
Yes.
Yeah. Okay.
Number 2, request for variance of lifeguard provision, Royal Lake condominium, 3 Royal Lake Drive, variance request plus regulation, 2 pages.
So this is a repeat request for variance, and the only thing I have is the actual request at this point. And the reason for that is, as you may recall, with COVID, the COVID event over the last year, initially the semi-public swimming pools and public swimming pools were not allowed to open. And when they were allowed to open, it was mid to latter part of the summer. And Royal Lake had made a decision by early summer, because it's a lot of maintenance to upkeep a pool and then open it. And the Royal Lake property, majority of that property are adults. It's an adult community, and more commonly than not, adult elders. And so they made a decision on the condo board that they were not going to open the pool last year, which they did not. So in anticipation, as things start to slowly open up more with the pandemic now, as we are, they're anticipating and hoping that they can open the pool. So trying to prepare themselves for that. So for that reason, I don't have any bathing data from last year because they were not opened. But in the past, as you may recall, this pool traditionally has a very low bather load usage. And they always have. Maximum I've ever seen probably at that pool at any one time, based on the data, is probably no more than half a dozen people.
Okay,
So the anticipation would be that if they were allowed to open this year, and they do choose to open, that next year they would be bringing forward data that was available from this year.
you need an approval for this?
Please.
Yes, I move it be approved.
I second the motion. All in favor? Aye.
Aye.
Okay. Roll call, Dr. Nettleman?
Yes, aye.
Dr. Bergoli?
Yes.
Okay. So the last thing that I wanted to update you on, well, two or three things. Just to update you on where we are with the COVID vaccinations. As you may both be aware, the governor, effective March 1st, stopped sending vaccination to local municipality. And it's all being funneled to the state level sites as well as pharmacies. So we had
Bad
started.
decision.
Yeah, we're not at all pleased with it. Medical Chorus has been very earnestly trying to partner with Brewster Ambulance to see if we can continue our vaccination program, but they are as well at the mercy of the state for receipt of vaccine. So, so what we can do is complete our second dose clinics. And so we've just finished a large one last Saturday, the 6th of March. We have another large one, a second dose clinic this coming Saturday. Saturday, the 20th, Brewster was able to obtain some vaccines so that we can finish our registry list of those 75 years of age and older, because the mayor was has earnestly been trying to make sure that that has been able to be finished. And then, so that would be a first dose clinic, and Brewster is, has been told they will get the second dose for that. That's going to be a very small clinic, probably maybe between 100 to 150 people to finish the persons on our list, the 75 and older. And then the last second dose clinic would be March 27th.
Mary Beth, when you first started the clinic, did you initiate the clinics? Did you start them yourself and request vaccines from the state? How did that work?
Yeah, so any municipality or any organizations, whether it be doctors' offices or community health centers or whomever wanted to offer a vaccine, they had to make application to the state through the state vaccine program, which we did. And as you may know, we already work with them now because we get all of our vaccine for children, all of the school vaccine that we offer for flu shots, that comes directly from the state. And Dr. Nettleman, you both would recall years ago, the state used to provide, in addition to what we purchased for flu vaccine, they used to also provide state supplied vaccine. So we've always been a part of this program. So when this started, we wanted to engage and be able to offer vaccine, COVID vaccine to the community, much like we do our flu clinics. Mayor was very supportive of that. And so we moved forward to get vaccine. And then, so what we would do every week is submit our request for what we wanted in vaccine. We opened a registry for our residents to be able to sign up any person 65 and older in anticipation that the vaccine would continue to roll out. And we were able to successfully start our vaccination program for those 75 and older following the governor's phased approach. We did the first responders, we did clinicians, and then we moved into the next phase, which was 75 and older. So we have been earnestly working towards getting that piece of it completed. And then the next phase was open, which is 65 and older and those with 2 or more comorbidities. And at that point, the governor came down and said, we're not sending any more vaccine to the locals. It's all going to the state. So unfortunately,
you couldn't have another clinic now if you wanted.
well, not at the municipal level. We would have to partner with someone, and that's why the mayor has been working very closely with Brewster Ambulance, which is our ambulance service in Braintree, to partner with them so that they're a regional ambulance service. So if they were able to get vaccine from the state, then we assist them. They provide us the vaccine, and we stage up the clinic with staff and registrants and all of that.
Okay.
And so it's been working very well with that. I don't know how much longer we'll be able to continue that. This is probably the end of it because they're getting very little vaccine themselves.
Thank you.
But it's been going very well. There's about 1,500 residents to this point, as well as first responders and clinicians that we've been able to vaccinate. So,
thank you.
And then also I did want to advise you that, as you're probably aware, spring is slowly rolling around. And so Norfolk County will be starting their spring aerial larvicide application for wetlands. That'll be coming up shortly. We'll also be rolling into, in May, our rabies clinic that we offer every year. So that will be outside as it always has been. So things continue to move along, even though we're in the middle of a pandemic, or maybe 3/4 into a pandemic.
Thank you.
Thank you.
But masks are still required.
Yes. Okay.
Okay. So now, Dr. Bergoli, have you been vaccinated?
I have not. Now,
Really?
remember, I am still antibody positive.
Negative. You're over your 90 days.
I'm still antibody. I do it every
Oh, you
month.
keep doing it?
I do it every first of every month. And then I send
Wow.
it to Todd Ellerin. And I told him, I said, this is almost a year.
Wow, good for
Now
you.
I'm debating what to do about the whole vaccine thing. If I was going to get one, I'd probably go Johnson & Johnson, but it's still a debate back and forth.
Got it. Okay,
Emergency use only.
I know. So that's all I have at this point.
Next board meeting, April 15th.
Yes.
I make a motion the meeting be adjourned.
I'll second that motion, Dr. Nettleman.
Okay, and roll call, Dr. Nettleman,
Yes,
Dr. Bergoli.
Yes.
Okay, thank you very much.
A
Thank
pleasure.
you.
Thank you.
So,
Bye-bye.
Dr. Nettleman, my question is, are you going to be coming out of the house?
well, the question is, am I allowed to come out of the
I don't
house?
know.
Oh, geez.
I was on the patio this afternoon.
I'll have to ask
Whoa.
Mr. Nettleman.
That's out of the house.
I'm right here, right here.
She's right here.
I can hear her, but you can let her know that Bertucci's is open.
They're open and they're waiting for you.
Well, we'll have to ask Kate.
Oh,
Okay.
okay. Well, she's in Maine, so you can't ask her now.
I think my first trip is going to be to the barber in about 2 or 3 weeks.
There you go. Sounds like a plan.
Who
All
wants to get vaccinated first, you know?
Yep.
Oh, boy.
Okay, well, thank you very much.
Thank you.
Thank you.
See you guys
Thank
next
you.
month.
You
A
too.
pleasure.
Thank you, Stephen.
Bye, guys.
Thank you.
Bye-bye.
Good night.
Bye-bye.
Bye-bye.
Bye-bye. Can I just turn this off?